So one of the things that's unique about the fellowship here in terms of what it prepares our graduates for after they leave Riggs is that in comparison to a traditional institute, which is really focused specifically on the psychoanalytic work, often in a private practice or maybe a community-based setting, but usually just private practice, the training here also involves a lot of work in groups and in our system as a therapeutic community. And so fellows really learn an enormous amount about consultation to groups, about what it means to work in a system, from a psychodynamic or psychoanalytic perspective, which really suits them well if they're interested in leadership once they leave here. Many of our graduates go on to be leaders in hospital settings or community-based settings, or even if their primary interest is in private practice, they often end up forming kind of consultative groups for clinicians in their area and kind of leading the charge in terms of what it means to hold patients in mind as a group, and to think about work collaboratively and across disciplines. This is another benefit that for anyone who's going to work with someone outside of their guild, Riggs prepares their fellows to really know how to communicate across disciplines and to translate something about the sort of psychoanalytic knowledge or experience we have with our patients, hopefully an experience near language that can bring a sense of understanding and containment to other people who are working with those patients, whether it's nursing or members of the community staff, or and when you're outside of here, it can mean consulting to units in a hospital, to providing some basic sense of understanding from an analytic lens that might not be there otherwise. Our fellows often also, if they don't stay around the area here in the Berkshires or at Riggs itself, end up being important contributors to psychoanalytic institutes in the communities that they go to, whether they're teaching or becoming training analysts themselves there, and certainly active at a national level in the different organizations that espouse psychodynamic principles and beliefs and ways of working with our patients. So, in short, I think our fellows are prepared to be excellent, competent psychoanalysts, both for very complex patients like the ones that we have here, but also for people with less complex issues or more kind of standard presentations at counseling centers, and are very well prepared as leaders in the organizations that they might go work in because they know how to work in groups and they know how to work in teams.
Just to put an exclamation point on what you were saying, Dr. Knauss, some years ago we had a reunion. We had periodic reunions of staff and patients, and one year we got together all the former fellows just to have a conversation about what they were doing. And it was a wide range. Most of them were doing individual therapy or analysis. But there were lots of academicians, there were consultants, some psychiatrists were doing, primarily pharmacotherapy even. But there was one thing that we discovered they all had in common, which is they had all become the go-to people in their local communities for complex patients and complex clinical situations. And so again, I think it emphasizes that the skill set that you're learning here is to really think deeply about both individuals and the ways that they engage the larger treatment system.